Hello and welcome to Noted, a very special program where we will be discussing weekly on various topics. Today, we're being joined by Dr. Sultanate Al-Khalili, and she's a doctor, the Director General for Disease Surveillance and Control at the Ministry of Health. Welcome to the program. Dr. Sultanate, how are you doing this morning?
I'm fine, Lakshmi, and thank you for having me for this interview for a long time.
Thank you. Now, of course, it's all to do with the vaccination. And on Sunday, we saw the beginning of the vaccination, the immunization process that's going on. And how was it going, this drive?
Well, in fact, it went very smooth and it went very great as we planned. We finished phase 1 already with a coverage rate of 95%, which is awesome, in fact. And yesterday, we started phase 2 of the stage 1. With a new vaccine, and also the people, they are coming in a great number so far.
So that's what I want to tell you. I want you to tell us about the complete procedure. Do people just come to the centers or do they have to register in advance?
Yes, they don't have to register prior to going to the immunization center. They just need to go, but they must make sure that they are under or belonging to the target group, which is for this phase is the age of 65 years and older, whether they are healthy or they are having any comorbidities or diseases before.
Okay, because in the first phase, we were looking at people who have diabetes or BP or other complications generally. So this time exactly. It's 65 and above, no matter what the fitness level is excellent or if they have a problem, it's for everybody above 65.
Exactly, as you said, because there are two different phases.
What should the public be aware of?
They should be aware of the instructions while taking the vaccine. For example, the vaccine is 2 doses. The vaccine is 2 doses, as I said, first of them started yesterday, and the second one will be given at interval of 4 to 6 weeks. They should be knowing that the vaccination itself is a complementary to the preventive measures. It's not canceling all the other measures. They should still commit to follow up the preventive measures like wearing masks, washing hands, and watching for their distance of 2 meters, avoiding crowded places, avoiding gatherings, and so on. Plus, the effect of the vaccine or the efficacy of the vaccine will be gained after the second dose, usually after 1 week or 2 weeks of the second dose. So prior to that, between the first dose and the second dose, the person would be still susceptible to the infection. So he or she should be careful of, taking precaution. The other thing is that whoever decided to take the vaccine, they should be committed to take the second dose of the vaccine whenever they are instructed to do so. Because 1 dose is, considered as insufficient to get the desired efficacy of the vaccine.
Is this also open to expatriates who are 65 and above?
Yes, for now, whether they are expatriate or they are Omanis, they are whoever belongs to the target group, they should go and get the vaccine.
Okay. Now, the question is regarding what you were just talking about and, what people should be aware and staying committed. Taking the first dosage is not enough. They have to strictly follow up with a second follow-up when the Ministry of Health, informs. Tell me, is there any reactions when people take? Have you noticed any reactions?
That's a good question. And you guess what, Lakshmi? It's good to have a side effect, in fact, of the vaccine, because getting the side effect is a proof that your immunity is working. And this is a proof that the vaccine is working in your body. Getting no reaction at all would be more worrying. However, the spectrum of the side effect is the most important. Yes, we got some people who are, saying that they are getting like pain at the site of the injection, fever, headache, joint pain, fatigue, and so on, which is lasting for 1 day to 3 days. But that's it. We did not notice any side effects, severe side effect, which need or require admissions, which require urgent medical management, and so on. So, the good news is that having side effect is a good news itself.
So when they have this body pain or the fever, because I know this is what worries most people, and should they take any medication, or do you recommend?
For me, I prefer to, fight the symptoms without taking anything. However, it depends upon the person. upon the how much is the reaction severe. For example, if it is fever, severe fever, or high-grade fever or severe headache, some of the people, they might go and get some paracetamol, for example, for analgesia and for reducing of the temperature. And taking, of course, plenty of fluids, juices. And the most important is that convince themselves and telling themselves all the time that my body start to work against this vaccine, and I will getting the efficacy, which is desired efficacy.
Very good, very good. How would you describe the new variant of COVID-19 now that is being recorded in Oman? Because what are the symptoms? Is it the same as before? There's a lot of mystery in this new variant.
Yes, you are absolutely right. You could consider them as naughty babies which were produced from the original virus because of mistakes. In fact, mistakes happen while the virus is copying itself again and again, while it is transferring from one person to the other. That mistakes cause something which is well known as mutation. The mutation is a change in the structure of the virus itself. However, with the change in the structure and with time, that change in structure will give the viruses some advantage which was not there in the original copy of the virus.
Because it's been exposed. Okay.
This is what's happening exactly in the mutations and new variants and so on. We have nowadays three variants of concern, we call them. One which was recorded and reported first in UK, the other one in South Africa, the third one in Brazil. The most alerting features of them is the widespread of them. They are more contagious. They have more ability to transmit from one person to the other. The UK variant recorded to be 50% or 50% to 70% more transmissible than the original copy itself, which is worrying, and starting to spread among people in so many countries. The other thing is that there are preliminary reports talking about increased risk of admission, increased risk of death as well among those who are affected by the new variants. However, those informations, they are preliminary. We are still waiting for more studies to come, more results expected also to be shown. The third concern is that the efficacy of the vaccines toward those variants. Some of the people, they start to talk already about decreased efficacy of the vaccines toward those variants. However, as I told you, still, again, this information is preliminary. There are mutations which are more aggressive. However, the decrease in efficacy, whether it will be, taking the vaccine toward the ineffective side or just decrease in efficacy, which is not that much pronounced, nobody knows. Still, we are waiting for the answer by the experts.
And how are the patients here in Oman? How are they doing, who have been affected with the new variant?
Yes, this is another good question. Besides the things we talk about in terms of differences between the new variants and the old variants, regarding the symptoms would be the same, more or less the same, apart from, the reports, as I told you, the preliminary reports of increased tendency of admissions and death and so on. The preliminary symptoms or the primary symptoms are the same. Those who are, reported, the 6 cases reported in Oman with the new variants, they are for travelers, majority of them for travelers who just came and traveled from their countries without having any symptoms. After investigation, we could not figure out that there is a clear, relation between them and between travels, which is, alert again. Do we have, a community transmission of those variants?
Yes.
That's the concern, and that's why the instructions coming there and there, to take the precautions and to take the vaccine to cut off the transmission chain for the virus.
So we're going back to what we used to talk again and again. That's like break the chain. We have something to be concerned about, and especially for our senior members in the society. Do you feel some of them have been hesitating to come forward? And does the Ministry of Health actually, follow up who have come in? Because you have the records as in Oman, it's free. The healthcare system is free for the citizens. So has there been like a collaboration of actually testing or following up with people who haven't come in yet? Or do you feel everyone's eager? Or do you feel people are hesitant also?
Some people, of course, they will be hesitant everywhere regarding the vaccination taking, regarding the following up the instruction itself, the precautions, the preventive measures. However, I mean, let us make it simple for those people. Now we have, I mean, in terms of fighting this pandemic, we have two scenarios. We have scenario one in which we got, I mean, the preventive measures which prove themselves to be effective and efficient. The second one, a vaccine which prove its safety and efficacy toward the original virus at least. I mean, so many talks also of, I mean, insufficient efficacy toward the variants, which is not yet, I mean, proved. This is the scenario one.
Yes.
The second scenario, we have a devastating virus which is spreading everywhere like a fire. It killed and infected millions of people and continuously doing so. We have new variants which looks like more severe, more worse, or more transmitting among the people. So, I mean, it's their choice now. I mean, whether they want to help themselves, help others by taking the first scenario, or they want to just simply give up and help the virus by taking the second scenario.
Good point, actually. So it's like, noted. So
I convinced you now.
Yes, of course. Noted is a program where we'll be taking a look at different topics weekly. And of course, joining us now is Dr. Sulain Al-Khalili. She's the Director General for Disease Surveillance and Control at the Ministry of Health. Now, there are also others who are keen and eager because they want this problem to be out of the way. So, but they're not 65. What should they do? You know, they're asking if they can go to any health center and actually ask for it. Is that possible?
This is a good point for me because I know now for sure that there are so many people who are keen to take the vaccination, so they will support the campaign itself, the national campaign, which is a great success, in fact. However, I mean, when we are deciding the target group to be given at a certain period of time, we decide that based on so many factors. First of all, the international and the national population-based studies, analytical studies, which said that this category is more prone for, I mean, complications, more prone for admission and death. So that's why we target them first. So it's either a high-risk group with comorbidities, including elderly people, and those are the most important at-risk group. Then there are risk with comorbidities, as we said. This is the at-risk group, high-risk group. We have a priority group as well, those who are a frontliner, like healthcare workers and those who are working in the other side. So when we are choosing them, we choose them according to the studies, according to the WHO, for example, instructions. We choose them according to the percentage, for example, of those who are having immunity already by the mean of antibodies, because we run already the national survey study. We got the result of that, we include them. And for those who got infected already before, we have some information about those who infected before. So I mean, doing a summation, doing our calculation, then we decide. So now for those who are 65 or above, they are the most important group to be covered during this period. The others, they are, yes, important, and they will be targeted, I reassure them. The vaccination will continue to come in a period of times, different period of times, and we will be announcing different target groups of people accordingly. So that does not mean that they will not have it. They will not have it now because of so many reasons I mean, said already. Yes. Because also there are a shortage of vaccines everywhere in the world. So we have to prioritize those at-risk group people. Okay. But their turn will be coming, and I wish that their love to get the a vaccination and that motions will be continuously until that time.
Very good. But you actually gave me another question. You know, as you've done the survey, Ministry of Health has done the survey on the people who have already gained the antibodies and also who haven't the random checks. Now, should those people who showed symptoms of antibodies in their body should go for the vaccination drive?
Those, in fact, will be excluded. Not excluded at this period of time, because as per study, there is nothing against giving those who got infected before by the mean of confirmed PCR testing or by the mean of antibody availability in there, but there is no, such contraindication to give them the vaccine. Still, they can get, benefit, double benefits. Benefit by getting the infection previously, natural immunity, and the benefit of getting acquired immunity by getting the vaccine. However, they are not a priority as such now. Because as I told you, we have a priority group, we have a shortage of vaccines, so we have to match the things. True. But if the situation continuously, being the same, and the pandemic will be continuous, for example, in the future, we might include them in the future. Okay.
And as long as we continue to receive the vaccination too, because as they say, there's a shortage. Well, I want to say thank you so much, Dr. Sulain Al-Khalili. You've really given us an insight, deep insight, and an understanding, because there have been a lot of questions. And, now we know anyone who's watching us right now can actually go to the centers. And I think you've given us already the centers.
The centers will be announced there in the social media of the governorate and of the Ministry of Health. They can just, go through them. And majority of the centers are same like the previous phase, but we are, planning to increase the number, because we are, understanding that we are targeting now elderly people. It might be difficult for them to go so far. So we want to make it more convenient for those people.
Okay.
There is one more point, Lakshmi, we need to emphasize on, which is those who got the vaccine before yesterday, those who got Pfizer vaccine in phase 1, and they are awaiting for the second dose of the Pfizer, they are not targeted by this phase, because we are using now a different vaccine, which is AstraZeneca. Their second dose will be coming soon, and it will be announced in the media by the Ministry of Health to go and get their second dose of Pfizer.
So I'm sure they're also eagerly waiting. There's a bit of, so if this campaign is going on, then you have extra work to do to identify who gets which vaccine.
That's easy, because we got them a card, vaccination card, in which we write clearly which vaccine, which date of the first dose, which date of the second dose as well.
Excellent. Well, on that note, I say thank you to you for your time and your insights, and wish everybody at the Ministry of Health all the best and good health for everyone.
Thank you very much for the people alerted about these issues. Thank you very much.
It's very important for us, and thank you indeed. And you've been with Noted, a special program that will come to you weekly with different topics of the week. I'm Lakshmi Sultanate from Oman Observer, thanking you for joining us with Nasser Al-Harasi.